Assalamu alaikum wa walaikum farhan. Guys, welcome back. Sorry, we have some technical issues the first time we tried. Uh, we are back on Facebook Live again, inshallah. So if you can hear us, write down comment tiga, say you can. If there's some issues on the Magdalene or you can hear Adana Magdalene, go ahead and write down some comment, inshallah. And let's go. And inshallah, as we said, today's topic was what is mental health? This is our first time we're doing this on Facebook Live. We are trying our best. This will be a formal, just, first time trying. If you have a question, write down on the comment, inshallah. As you guys know, my name is Farhan. And today our topic is what is mental health? My guest, Hawaii Marian. She is our case manager at the Somali Community Center. And inshallah, she will give us what is mental health, the answer that we've been looking for the last probably few years. Marian, welcome, inshallah. Introduce yourself and tell us your job when it comes to mental health. And yeah, go ahead.
Assalamu alaikum, everybody. Thank you for bearing with us. We do not know technology, wallahi, but inshallah, this is going to be better. My name is Marian. I am a licensed clinical social worker. So I have a master's degree in social work, and my focus in practice is therapy and mental health. I've worked in a lot of different settings. Mainly, my focus is working with children. It's really what I'm passionate about. I've worked in trauma centers with kids doing outpatient therapy. I currently work at a psychiatric hospital, the Burke Hospital. I do that part-time now. I also work for a health insurance company, Humana, helping our Medicaid members get access to behavioral health care and mental health care. So inshallah, we'll have trying to bring all of that to our community, have a discussion about it, and we'll see where that takes us, inshallah.
Inshallah. Thank you, Marian. And as you understand, this topic of mental health, when it comes to our community, Somalis, this is a taboo topic. And I want to, take that gap and let's, talk about what is mental health. This is an issue that we've been facing last few years. Probably more than the last few years, but it's been getting worse and worse. And one of the reasons that we are here today is to discuss what is mental health. Just understand. And I want to hear from your side, Marianne, because this is your expertise side. Please tell us what is mental health, and I will also add in my experience.
Absolutely. I think obviously the stereotype and the negative connotation doesn't necessarily come from the idea of mental health in general, but more of like mental illness. So inshallah, today maybe we'll just I'll touch on the difference between them, right? So mental health is something that we all have. It's the equivalent of physical health. So if you go to the doctor for any physical health reasons, that's okay, right? And we go see a therapist or a psychologist or a psychiatrist for all of our mental health needs. And every single one of us has a level of mental health, right? It's really about how are we doing emotionally? How are we doing psychologically? How are we handling stress, right? Now, when things become too much, when we're not coping with life's stresses, then, maybe we'll develop a mental illness, right? But just because we can't cope necessarily, it doesn't necessarily mean that we have a mental illness. It just means that we have some struggles. So there's a big difference between like mental health in general. And I hate that it gets a bad rap because we all have a level of mental wellness versus, those of us that struggle with a mental illness.
That's thank you for that. That's a good answer. But my other question is, what is mental health in our community? Just let's talk about our Somalis. What do we say about it? So in your terms.
Yeah, we had actually, last weekend we went to the Duxie here in our community and had a discussion with the kids, and we asked them that same question, what are some of the stereotypes that go around in our community related to mental health in general. And the kids are so smart, wallahi, mashallah. They were, everybody knows what the stereotype is. When I tell people I'm a therapist in our community, they're like, oh, the dua ala shaqesa, or, people that just can't handle themselves, or people that are not connected to Allah, people that, don't have any deen, when in reality, that's, we know it's not true, right? I can be somebody with a great level of iman, but still struggle with my mental health. I could be somebody who has a mental illness, but it doesn't necessarily mean I'm someone who's crazy, right? In any sort of way. But that's sort of the stereotype. And then the big stereotype is that, mental health is only an ajnabi thing, right? Like it's a Western construct, and it doesn't necessarily affect those of us that are not Maroccan or ajnabi in some type of way.
Okay. So what are the symptoms or signs that this person has issues or mental health? Like what are the symptoms? Are there, how do we know, like let's say maybe my brother, my cousin has issues, mental health. I mean, how can I know? Because I've never seen this before. This is something new to me. What are the signs, Isha?
Yeah, I mean, there's really a lot of signs to look out for that can indicate that someone is maybe struggling in terms of their mental health. The greatest indicator, to be honest with you, is just asking somebody, right? And typically, if you ask somebody, hey, how's your mental health? If you have a good relationship with that person, if you know that person, inshallah, they'll be honest and really give you some sort of insight into how they're doing, sort of in terms of their wellness, right? Their mental wellness. Some things to watch out for is, how is this person taking care of themselves, right? Is there, are they, did they used to do really well in some area and now they're not doing well? Like, are they not having a lot of energy? Are they, in terms of emotions, are you finding that they're sort of showing their emotions in a way that is not appropriate for the situation, and it's out of character for them, right? Like, let's say I'm someone who typically is not, I don't get angry a lot, but if I'm struggling mentally, maybe I find myself just snapping a little bit more, right? Like I get angry really quickly. Maybe I'm not sleeping well, right? Maybe I'm not taking care of my hygiene, right? Maybe I'm avoiding certain situations because I'm constantly worried about what could happen, right? So any sort of deviation, like anything that is outside of their normal habit, if it's consistent, if it's severe, it is something to say, okay, let me ask this person this question, right? On the other hand, those are sort of like, you know, just low level, not necessarily low, I don't want to say low level mental health, but like, they're not crisis, right? Because then there's the other side of it, that if people are, there's I don't know how to word it, but watching out for sort of crisis situations, right? Like people, because I mean, we don't necessarily want to not have conversations about the reality of our community where people are actually hurting themselves, where they're hurting others, where they're using drugs, right? Those are all indicators that somebody's not doing well in their mental health.
Okay. And so if someone says to me, Farhan, I have some depression, I'm not feeling well, I'm not myself, I need some help. What are the steps to do? Like, what do I have to do? How can I help this person?
Yeah, really the first step, and it depends on age, right? So if it's an adult that's saying, hey, I'm feeling sad a lot, right? Like I'm very sad, I'm not going to work, I'm not taking a shower, I'm not eating well, right? If their depression is sort of affecting their day-to-day life, then the first thing that they could do, if they have health insurance, right? Because we know the medical system is pretty hard to access without health insurance. But if you have health insurance, the easiest thing to do is talk to your primary care doctor, right? If you have a primary care doctor. If you don't have a primary care doctor, you can come to us here at the Somali community of Louisville, and we'll help you access resources on how to get mental health services. And if you don't have health insurance, we'll try to help you find somewhere to go that, maybe can do, because there are per diem rates. So that's where a therapist will charge you based on your income, right?
Mm.
And you don't necessarily have to have health insurance. Now, if you're a child, the best thing to do with your kid is really to take them to their primary care doctor and let them know, hey, this is what I'm struggling with my child. And primary care doctors have the ability to do referrals for psychiatric care and mental health care. So
Mm.
that's really the easiest way. Now, if you know where to go in Louisville, because we have an abundant amount of mental health facilities, um, you can go to any therapist and you don't necessarily need a referral from your primary care doctor. You can just go to 7 counties, Ocoleto, and say, hey, I want to get assessed. And they'll assess you, set you up with a therapist, and you'll be good to go.
Okay, thank you for that. And so if they need help, in our community, so they should call you. What's the phone number they need to call? Like, let's say I don't know where to go. I want to call you so you can help me uh, directions. So I want to call Marian. So what's the number?
Yeah, I definitely am here to serve our community in any way that I can. So you guys are more than welcome, those of you all that are tuning in, to call me. My number is 502 264
Mhm.
6543. So call me. You can text that number as well. Um, and I do want to say that, we, in our community, obviously, there's a lot of boundary issues where everybody knows each other, right? I'm pretty sure, people know you. Um, there's confidentiality, right? Like if you call that number and you want to talk about something or you're asking for help, there, as a therapist, I am bound by confidentiality that I'm not going to tell other people about the conversations that we have. I'm not going to let it be known that you are someone that has given me a call. Even if I see you on the street, I will not, this is not something that is going to leave the privacy of, even though I'm not going to be your direct therapist, I am bound by confidentiality as a clinician that I will not be disclosing, this phone call that you make to me or the things that you share, or the things that you ask for help for.
All right. And my other question, that's good. So they will call you, you keep it private. This is just, because of so many reasons, as you said. And so what are the hours they can call you? What hours do you have? What are the hours they can call you during the day?
That's a good question because I've been getting I've been getting some random phone calls. You know, really you can shoot me a text if it's after business hours. So anytime after 6 o'clock, just you're free to text me and I will give you a call back. I probably won't answer, but anytime between 7 a.m. to 6 p.m. you can give me a call.
Okay. Yeah. Just give a call during business hours, not after hours, inshallah. If it's after hours, you can send a text message.
Yeah.
Okay. So Marian, my question is, let's say someone comes and they need the help. They need to go to therapist. Okay. Let's say they need, usually it takes, how long is the process? Because I don't know. I want to know like how long it takes someone, or it depends. You tell me how long it takes someone to get the help they need usually. What are the time on this?
Yeah, it really depends on where you go. There's different levels of practices that people open up. 7 counties is one that I've already mentioned, and it's the big agency here in Louisville, right? So they have a lot of resources, a lot of therapists, but there's also just a lot of therapists that are in private practice or smaller therapeutic agencies. Um, and unfortunately, we're still in sort of like a post-pandemic state of care right now, where a lot of these places are very busy because coming out of the pandemic, people realized that they really needed to take care of their mental health and they had a really hard time. So they are very busy, but typically, you're able to schedule an appointment. Your first appointment is typically like an assessment, right? Like if you go to the primary care doctor, it's your physical, right? So this is sort of the mental health version of that, where they ask you a lot of questions, try to get to know you, And then after that, your second appointment is with your own therapist, where you get to get to know your therapist. You get to have conversation, make goals about what you want to accomplish. Right? We never want to go to therapy and think that we're not going to do work, because therapy is work, right? You're going there for a specific reason, whether it's to manage your depression. You want to have goals around what you want to be able to accomplish, how you want your life to look. So it's the assessment is the first appointment. The second appointment is typically with your therapist, and you do like a goal setting session. And then after that, you just, take it from there and have these conversations.
Okay, thank you. And I just want to say to the new ones who had came in, those who came in, today is how we only speak in English, inshallah. The reason why we speak in English, because we have so many young folks or some who don't speak Somali, so they understand, what we're talking about. Next week, inshallah, we will have full Somali. So that's, someone asking me on the comment, but that's why I'm asking this question, how we have to reach those who don't speak Somali. And the other one is, Marian, can you please explain what is therapy? Because some folks don't understand that. What is therapy? Therapy maha.
Therapy is it's to me, Aniga, when I think of therapy, I think of a relationship with a professional, right? Like a caring relationship with a professional. So for example, if you come to me and we're doing therapy, my job as a therapist is to get you to a place where you feel comfortable, where you feel safe, where you feel like you can do the work that you need to do, right? And that work is whatever you deem it to be.
Okay. All right. Yep.
I do want to say though, therapy, because we have a lot of misconceptions about therapy, because therapy is not, the place that you go and you just, talk about, it's not an unstructured environment. You don't go to therapy and you just dump everything and then walk out. It's a place where you do real healing. And it's also a place where you do real work, because nobody, it depends, depending on what you're going through. If you're just having some struggles with your mental health and you just want somebody to help you work on your thought process or work on your emotions, work on helping you see things in a more realistic light, you want that to be a short-term relationship. Whereas, if I'm struggling with like severe mental illnesses, right? Because I think that's a lot of times when people think about mental health and mental illness, they think about the severe ones, right? They think about schizophrenia or psychosis, things like that. They don't necessarily think about sort of depression and sadness, or just anxiety that occurs in certain settings.
Okay. MashaAllah. Thank you, Marian, for that. And let's give a chance to those who are watching us, inshallah. If you have a question, you can ask, because we don't want to just go ahead and finish. Oh, we've been talking almost 20 minutes now. So if you have a question, go ahead, put in the comment. I'll give you a minute. And then we can, wrap up this. Let's see. Do almost 20 folks. The reason why, inshallah, why we're putting the comments down is the reason why we have this topic is I've seen so many folks in our community, especially Somali community. I've seen people struggling in mental health, but they don't know how to handle it. They don't know how to get help. They don't know who to talk to. But now we are trying to solve that problem, inshallah, where Marian comes in and be the contact person, or you can talk to, or you can talk to me. I will try, even me myself, how I'm learning how to handle, those kind of cases. Someone needs help, or I myself need help, so I can go ahead and, find the need, inshallah. But we're all learning. Nobody is perfect, inshallah, and believe that this is a learning process. You always learn something new. Ask, you know, we are here also, to ask questions and learn from you too as well. Marka, I don't see any questions so far. It's almost 6:30, right? That's our time limit for today. Marian, do you want to add something?
No, this is just going to be one of many conversations that we have. We want to be able to bring this knowledge into your all's homes and into our own homes, and have a way for our community to be able to get the help that they need. Because we know that it's not because people aren't struggling. We know our community is struggling in a lot of ways. We see the path that a lot of people are going down, and it's really because of the lack of knowledge about what is available to us here in the community, that people are just not getting the help. So inshallah, Allah make it easy for us. We want this program to be a success. So we want people to feel comfortable to use that number to ask for help, and know that we'll try to help as best as we can.
All right. Inshallah. Thank you, Marian, for coming in today and giving us all this expertise, Kaga. Thank you for giving us all this information. I want to say a couple, but thank you for joining us. Inshallah, I will save this video and put it onto our YouTube page here. So I will have it on our YouTube page in case you missed this live. You can go back and watch, inshallah, and share. Thank you. Assalamu alaikum, Marian.